Right now, she's assessing the situation, making sure it is safe for her to help the citizen with CPR. Then goes up to the citizen, asking if they're okay, tapping their shoulder.
Hey, are you okay?
She will then be conducting the look, listen, feel. She is looking for respirations for 5 or 10 seconds. Now she will be doing the listen test. She places her ear over the mouth to listen for respirations. Now she will be doing the feel test. She's taking the cardio pulse that is located on the neck below the chin.
Hello, we have an emergency.
The victim lying on his or her back, tilt the head back slightly, lift their chin to open up their airway. Now you will listen for their breaths once more for no more than 10 seconds. Now you will be looking for respirations for no more than 10 seconds. Now you will locate the end of the person's breathstone, where the ribs come together. Place 2 fingers at the tip of the breathstone. Place the heel of your dominant hand on the breathstone at the center of the person's chest. Place your other hand on top of your dominant hand and interlock your fingers together. Position yourself with your shoulders above your hands. You will then use your body weight to help you administer compressions that are at least 2 inches deep and delivered at the rate of 100 compressions per minute. She will now conduct 30 compressions and 2 respirations. She will begin the compressions right now.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19,
She will now be conducting respirations for the unconscious citizen. She is now checking the citizen for life signs.
Hey, are you okay?
Go.
Okay, so then I look, the chest is rising. I check if they're breathing.
It's dead.
And then I check their pulse. Okay. Call 911.
After making sure the victim is in critical need of CPR, one person will prepare for compressions and the other will wait for the 30 compressions to be over to administer the 2 breaths. For compressions, locate the end of the person's breastbone. Place 2 fingers at the tip of the breastbone. Place the heel of your dominant hand on the breastbone in the center of the chest. Place your non-dominant hand over the interlocking with the dominant hand. Use your body weight to help administer compressions at least 2 inches in depth and at the rate of 100 compressions per minute. When giving breaths, you want to make sure the victim's lungs are completely inflated and deflated. The other person who had done compressions will need to make sure the person's chest is rising and falling. Repeat the process continuously until professional EMTs arrive or until the patient is showing signs of consciousness. She will now be checking if the citizen has any life signs. She is checking for breaths. She is checking for respirations. She is checking the pulse. If the citizen still does not seem to be breathing on his own or her own, you must do the CPR once more. As you can see, she is conducting to do CPR while I help her with the respirations. She is doing the 30 compressions at a 100 rate per minute. I will then assist her with giving 2 respirations once she is done with the 30 compressions. As you can see, I have the instrument in my hand to be able to conduct the respirations for the citizen. She will be checking if the citizen is inflating and deflating with the air. Once we are done with the CPR and we notice that the citizen is able to breathe on his own or her own, the citizen is good to go and now they are breathing properly.